If you're trying to get pregnant, here are 6 things I need you to start doing today. If you're new here, welcome to Health Corner. I am Dr. Shalom T. I'm a medical doctor, and here I go over daily health tips. I also go over different health topics so you can make informed decisions every day. If this is something you're looking forward to, please subscribe, like, and share this video so you do not miss out on any updates. It's important to prepare for pregnancy so you can minimize the chances for miscarriage and also minimize the occurrence of birth defects in your baby. Ideally, you need about 3 months to prepare your body for this amazing experience. But if you're looking to get pregnant quick, don't worry, I got you. Tip number 1, healthy lifestyle. This is the base for everything. Make sure you're eating healthy, make sure you're drinking healthy. If you love alcohol, you need to really reduce the quantity of alcohol that you take, or if you can actually stop it, just stop it. Because alcohol increases your risk for premature delivery, low birth weight in your baby, and also something called fetal alcohol syndrome. You do not want this. So start to reduce your alcohol intake from 3 months before you actually anticipate conception. Also, if you're a caffeine addict, that is if you're a coffee addict, you need to reduce the quantity of caffeine that you consume. If you can reduce it to a 12-ounce cup of coffee a day, that will really help out, because consuming large amounts of coffee has been showing to prolong the time it can take for you to actually conceive, and it can also affect the baby in different ways. If you smoke, you want to stop smoking or bring it down to the most minimal level possible, because smoking has a negative effect not only on you but the health of your baby while in the womb. So as a general rule, make sure you maintain a healthy lifestyle. Eat right, drink right, stop smoking, reduce alcohol consumption, reduce your caffeine intake, just generally stay healthy. Tip number 2, avoid certain medications. Nowadays, every woman wants to add retinol to their skincare routine, but if you're trying to get pregnant, this is absolutely not for you. This can have negative side effects on the baby, so you just want to completely avoid this. If you're also on some treatment for acne like doxycycline, you want to actually talk to your doctor about it, so maybe they could switch you to something that is a little bit more safer. Also, if you're on antidepressants or you're on treatment for certain chronic diseases like diabetes, hypertension, thyroid disease, epilepsy, amongst many other things, you may want to talk to your doctor first so they can go through some of the medication you're taking. If they can actually change you to something else, that'll be even better. But if that's not possible, it's still okay. Just talk to your doctor, because some of these medications can be harmful for the baby. Please do not abruptly stop taking your medication. That is very dangerous. Always make sure you talk to your doctor if you're trying to conceive, or if you think that the medications that you're on can actually be harmful to your baby or can reduce your chances at conception. Talk to your doctor first. Tip number 3, maintain a healthy weight. Being severely underweight or being severely overweight has an impact in your fertility rate. It can either make it really difficult for you to conceive, or it can increase the chances of you having miscarriages once you do conceive. So you want to make sure that your weight stays in the right range. You can know this if you calculate your body mass index. That is, if you get your weight divided by your height squared. It's going to give you a number. Just Google, right, and see if your number falls within the right range. It'll tell you if you're overweight, it'll tell you if you're underweight. This is where exercising can come in handy for my women who may be overweight. Also, as a general rule for everyone who is trying to conceive, because not only does exercising burn fat, it reduces stress, it improves your overall mood, it helps with your insulin levels, and it can also balance your hormones. So generally, exercising is good practice for everyone. If you feel like you're overweight, try to lose weight. If you think you're underweight, try to gain some more weight. No shade here, guys. I'm a medical doctor and I just have to tell you the truth. Tip number 4, supplements. You want to make sure you start taking your supplements at least 3 or 2 months before you anticipate conception. Just go to any pharmacy, drugstore, and ask for prenatal vitamins because they help actually prepare your body to conceive. Make sure you start taking folic acid 2 or 3 months prior to conception. This helps prevent neural tube defects in your baby. This is a condition that affects the baby's spinal cord. It is simple to prevent. Just take your folic acid. You can add vitamin D because it also goes a long way to nourish your body and to help the baby. So, take your supplements early on. Tip number 5, understand your menstrual cycle. This sounds pretty simple, but you'll be surprised the number of women who have no idea the length of their cycle. They don't even know their safe or unsafe periods. You cannot be trying to conceive and you don't have good mastery of your cycle. Please keep track of your cycle so you can try for conception at the time that is right for you. Because just so you know, not every woman ovulates on day 14. The day of your ovulation varies depending on the length of your cycle. So you want to make sure that you log in your cycle every day, every month, whenever your menses comes. And it's so easy nowadays. You don't need a calendar or anything. Just if you have a phone, go and download any app that can help you track menstruation. Personally, I use Flow. I've used it for a very long time and I absolutely love it. You just need to go on there. When it's the first day of your menstruation, you log it in. It is going to tell you when it predicts you're going to be ovulating. It's going to tell you your safe period. It's going to tell you when you should try some more or you should put some more effort, right? So guys, make sure you track your cycle so you can try at the right time. Tip number 6, go talk to your doctor. Hey, there's nothing wrong with you going to tell your doctor, I'm trying to conceive or I have the desire to get pregnant. Make this a habit because it actually helps certain things to be diagnosed early on, especially for my people who have been trying to conceive for 6 months, 1 year, 2 years. You've been taking all these different supplements to no avail. Girl, it's time for you to go see your doctor because certain causes can be caught earlier on and you can improve your chances of conception. Your doctor may actually recommend certain medications that you may need to take that is specific to you and the problem that you have, or they can just give you general advice. So it is good practice, all right? Talk to your doctor. There you have it. 6 things I need you to start doing today if you're trying to get pregnant. If you found this video helpful, please share to your friend, share to someone that may need to see it. Don't forget to subscribe and turn on post notifications so you don't miss out on any other updates. Thank you so much for watching. I'll see you in my next episode. Bye-bye.